Hey, this is Malika of Evanston Live TV, and we have back with us today Dr. A. I told you all we were going to bring him back for a follow-up. It was such a great interview. I think the audio was a little muffled, and what he was saying was so important. So I was like, no, we have to do it again. We have to do it again, Dr. A. We have to do it again.
No worries. I'm very happy to be here again, and thanks again for the invite. And this time I came to the office to show a little bit about what I've been doing and then what we're up to.
Yes, yes. So your office is located where? That looks
Yeah,
very familiar.
let me show you around. Okay, I'm sorry guys, I'm with the mask. Maybe you'll not hear me well once I get into the office. Today, we're not seeing patients, so I'll be fine be in the office without mask because I have no patients. So once I get in there, I'll remove it and you might hear me better. So that's like the locations in front of a Food for Less gas station. I think it's well known here in Avesta. It's pretty busy gas station. And then right here we have some restaurants, and then we have right there Way Dental. That's our house, and then where we enjoy seeing patients and seeing what we call our family, our Way Dental family.
Okay, so you're off of Main Street by Food for
Mhm.
Less.
Exactly, it's 2424 Main Street.
Okay. All
It's
right.
the same plaza as Sam's Club.
All right. All right. Well, I'm looking forward to coming. I've been needing a dentist, and for those who missed yesterday's interview with Dr. A came to my defense. He was the voice of reason on a Evanston Live TV page thread where these women wanted to debate with me about the importance of wearing masks during COVID-19. It was insane. So,
Yeah, it was unbelievable. It was really unbelievable. But I feel like wearing a mask nowadays, it's a sign of you care. We love that you're our community. We love our neighbors, and that's why we are in the mask. It's not about freedom. It's about caring. It's about love. That's what it is. And then I believe that being with the mask, it's gonna be for a while, and then it's not gonna be forever. We've been through other kind of disease out there that kind of pandemics, but like we get through it. We get through it stronger. Okay.
all right.
So now we invited to our house, so I'm gonna walk through here to show you a little bit of Ray Dental. Let me switch the camera, I think, so you can see better the office.
Okay.
Let me try.
Yes,
Let me
take us in
try
Wade
here.
Info. Looking forward to checking out the office.
There you go. Now you can see a little better. So just for the audience to know, everything that I'll be touching now, I will be wiping later with disinfectant. So um, it would be very nice and clean afterward. So that's the entrance area. So right now I'm gonna remove the mask. The mask. The reason is because I removed it so you guys can hear me better, and I can show you through. Okay, that's the waiting area. So from now on, we will see, as you can see here, with 3 chairs and more chairs here. So we used to see multiple patients, but now we won't be able to for a while. So we see one patient at a time, maximum one person here waiting. So they will walk in through here, and they will be greeted by one of our team member. And then I'm gonna show you the other side, what they're gonna be offering. I'm gonna check temperature, offer hand sanitizer, gloves. If some patients, they get really scared of touching things, so you're more than welcome to ask for gloves. We will provide for you. Our paperwork, everything afterward is shredded. Everything you touch it, patients touch it, you'll be nice and clean with medical grade wipes.
So Dr. A, what you're pretty much going through, so people understand, is that you've had to change how your dental office even operates daily. So where you used to have office full of people waiting in the waiting area, now you have to take one patient in at a time. You have to sterilize everything. You take their temperature.
Yes, we check the temperature, and then we always followed a very strict protocol. We follow the guidance of the CDC, and then we are very strict about hygiene, very strict about sterilization, disinfection. So it's just a matter of now adapting to this newborn disease, to the unknown. So that's basically what it is. But we basically treating every patient if they are like contaminated, not that they are contaminated, but we want to be cautious because we don't know who has the COVID or who hasn't. Sometimes they have no symptoms and they can spread the virus, So that's the biggest concern out there.
Wow, wow. So how have the patients been responding to the new way in which you run the office?
They've been responding really, really well. I feel like they noticed that we are doing this because we care. I'm a very warm doctor, so I like to high five my patients. I even hug my patients, so I can't do that anymore. And then some of them are like, doctor, I miss you high fives. But it is for a good cause, That's the reason for my change. And then just to show you a little bit of from here, so we have the thermometer here, so it's like we don't have to touch the patient with this. It's pretty accurate. We have hand sanitizer that we offer the patient. We have shields for the staff when they're like seeing patients. Right here, as you can see, we have gloves, Lysol. When patients they leave the office, we make sure that we Lysol the areas, the waiting area, the hallways. We have medical grades wipes to wipe every surface that we possibly be contaminated. So those are the things that we try to provide safety for patients and for the staff.
Wow, wow, that's so much more. I mean, does your staff have to come in a little bit earlier to now prep and prepare for?
Yeah, definitely. And then also between patients now, we need a little more time because as they walk through the doors, we have to wipe the knobs. The bathroom, that's the bathroom. We try to clean it. If a patient goes there, as soon as they leave it, we try to wipe as well the knobs, and so to make sure that to avoid cross contamination.
Wow, that's whoo, we're in a new
Yeah,
time.
it's a lot. It's a lot. I feel sad, and there is this space here that I love this space because that's where I sit with my patients to talk with them about treatment planning, answer questions, and then now I cannot use as much. It's a very confined room, so we are trying to avoid staying in that room. As you can see, it's a small table with 4 chairs, and then the social distance is not allowing us to be that warm inside.
Right. Wow. Wow.
Hopefully we get back on our time that we could be hugging each other and saying hi to each other, and then will be a easier life.
Yeah, and I know going to the dentist is like, terrifying for most people. So to have a dentist like yourself who's very warm and compassionate and, hugs them and comforts
I
them.
appreciate you here.
So what is that like for those patients who are just deathly afraid of dentists and now it's kind of, you know, everybody has to keep their distance and how,
Yeah, and that's definitely a big problem, because that's what I tried my best to show patients, like, hey, we are doctors, we are dentists, everyone's afraid of dentists, but we're human beings. When we care for you. I'm here not to drill your teeth and then do a surgery and let you go. I'm here to do something good for you. And then with the mask and the shield, and then it'll be an extra step. Some probably I'll have to do extra talk a little more, and also they can kind of get my personality beyond the mask and the shield and the goggles and all those things. But hopefully they'll see through how much I care, how much I love what I do.
yeah. Well, the spirit will shine through any barrier. Doesn't matter. The spirit will shine right through.
That's true. That's true.
So where are we right
So
now?
so let me show you. Those are the ops. And then we have now 2 ops. The office will be equipped with 5 treatment rooms, but for now, of course, with the whole COVID, we are trying to keep it lower amount of patients in the office. So we will keep it as 2 now. But as you can see, everything has a barrier, like the trays, everything that you possibly be touching throughout the procedure. We try our best to put barriers, plastic barriers that they're disposable. We'll be throwing away right after. And then as you can see here, even like the camera, the intraoral camera that I use to show patients like their condition, their problems, and they're like with the barrier as well. After we finish, throw away, and then you put a new barrier. And whatever whatever you touch, and then you cannot put a barrier. So then definitely we'll be wiping with medical grade wipes and then completely disinfecting for the next patient, and Lysol the air, and then we change to the next room so they can kind of switch rooms and give time to the aerosol to go down. For now, with emergency patients, we try to avoid aerosols, but later that will be necessity.
Wow, wow. So, with the aerosol, can you explain the whole aerosol situation? Because, some people say that the virus can stay suspended in the air for a certain amount of time. So, how does all that work exactly?
Okay, so we probably everyone heard about the droplets
Mhm.
and the aerosols. The droplets are the big drops of saliva or secretions comes from the lung. Those are the bigger ones. Okay, so as you know, like someone just talking, okay, those droplets can go 1 meter, just talking,
Mhm.
1 meter of distance. If you are coughing, it can go up to 2 meters. We're talking about 6 feet. So 6 feet, that's why the social distance is 6 feet, because that's how much those droplets can go, how far they can go, 6 feet once you cough. But let's say that you're just sneezing. Okay, all of a sudden, when you're waiting patiently for your line at the supermarket, someone in your back that they decided because of the freedom, they're not wearing the mask and they sneeze. We're talking about 20 feet. That's how far is the droplet with the sneeze will go.
Woo.
So that's why we are like, I'm so strong about, hey, wear your mask, protect others. If you don't care about yourself, at least care about the other, um, care about the community. So in talking about the aerosol, they're these very small particles. They're formed when we're using drilling, when you're using the Cavitron, the ultrasonic instruments in the dental office. So that's why everyone's getting scared. But for this, you don't have to be so scared in the dental office, because I'm sure like your dentist is taking care of it. So here in the office, just to give one example. So here in the office, we are adding, so I'm gonna show you here. So this, it's, again, I'm touching, but I will throw away this one after, but I put it here on purpose of showing the audience what are the possibilities to protect against the aerosol. So here it's a vacuum system that you put inside of the mouth. So the throat area, the very back of your mouth area. So be with this barrier, and it has a high volume suction. If you can hear,
Mm.
so whatever, like I'm gonna pull down again so you guys can hear me. Whatever saliva on the back of your throat, whatever droplets is coming from your lungs, will be already like captured by this first. Okay, so then we get the second barrier. The second barrier we have now, I added a mirrors with suction as well. So once I'm working, I can see through, and at the same time I'm suctioning. So again, to reduce the amount of aerosol that goes through the air. And then not enough. So we have again one more section that my assistant
Wow.
will be holding close to my drill. So then the aerosol that I'm producing will be captured by this vacuum. And then there is one more addition. Was for me, I'm trying so much to put my patient on the safe side. And then there is another one that I just ordered. It's not here yet, but you're more than welcome. I definitely can show once it's here. But it's a vacuum that will be closer to the face. So if something gets through this, I'll capture with that face. It's like a vacuum closer to the face, and it's a bigger one that will be capturing the remaining of aerosol that it got through, the winners.
Wow. So, I mean, not a drop is going to come from any of your patients.
I will try my best. I cannot promise like one single drop, but I can promise you I'm doing 100% of myself to put the patients on safe side.
Wow. That's I, I'm just amazed at what all everybody has to go through all these changes. But thank you
It's a
so
lot
much
of change.
for making sure that your patients are safe and your staff is safe. I mean, you're going above and beyond to make sure everybody's good.
Yes, and then definitely the staff really appreciate what I've been doing. They're eager to go back to work, and not a matter of only working, but a matter of like giving care to those patients in need. Some patients they've been calling us and it's like, "Hey, doctor, please, I need to see you." But I was like, "Hang in there, like just a little bit more, and they definitely can see you because if it's not emergency, we are trying to avoid treatment now." exactly to avoid the cross contamination and trying to follow the guidelines that American Dental Association and then uh, like the Illinois Dental Society is recommending. So we're trying to follow guidelines. But we're ready. As you can see, we're ready to go.
I see. I see. What would be considered an emergency for someone to come in like right now during this pandemic?
So anything related to trauma, excessive bleeding, if someone is feeling pain, severe pain, throbbing pain, all those things are considered like emergencies, and they definitely can give a call. And then if there is something that you have doubt about it, is that an emergency? So it's not. Just call. If you don't like, if you can call your dentist, if you like they cannot get a hold of them, just call me. I have no problem. It doesn't matter like if you're gonna be our patient or not. I'm here to give you answers, to give you guidance. You know, regardless if you're our patient or not. We definitely can give us a call and you can guide you. Hey, this is emergency. Look for your dentist. Or if your dentist is not available, I'm definitely here to help. I'll be seeing anyone in need because I just cannot think about the idea of letting those people go to the hospitals and be contaminated with
Mm,
the COVID.
yes, yes, yes. And you've been in practice for 15 years.
Yes, 15 years as a dentist. This office, it's new. We started this office here in Evanston because I love Evanston. You know,
Mhm.
I love the city. So I decided to open our practice here in Evanston. We just opened this office last year, but I've been in practice like 15 years. Before, as I said on the video before, I was born and raised in Brazil. In Brazil, I'm a orofacial surgeon. So when I got here, I went through dental school again, and I was like, I love everything. So let me do my cosmetic, let me do my family dentistry, general dentistry, and then like whatever surgery patients need, I'll be right here. We have a like that's the tomography. So as you can see, you can when I'm doing my surgeries, or if patient has lesions, you can get a 3D image, and then you can guide patients the best way possible.
Wow. So you went to dental school twice.
Yes, twice. That's true.
Oh, you must know the mouth, the teeth. You know everything inside out, backwards and forwards. You went
I
through it
can
twice.
Yes, I can tell you that I have studied a lot.
What would you say is like the difference between what you learned in Brazil, dental school, and what you learned here, dental school? Like, is there much of a difference?
So our like school that I have like accomplished in Brazil, it's amazing school. I had learned so much from there. So for me here was a matter of like adding the more like technology, adding more techniques, new techniques. US it's the standard of best care possible.
Mm.
So and that's what I like. I refine my techniques. So here in US, so that was the amazing thing, and I have done it twice. And then if you ask me, would you do it again? It was like, yes, 100% yes.
You love what you do. You have to, and your teeth. I said it in the first video. Your teeth are perfect. You have
Thank you. Thank
that
you.
Hollywood smile.
You're going to make me blush. Thank you so much.
Walking billboard for your work. It's great.
Thank
So,
you. Appreciate it. And then, as I said in the previous video, like, like look for your dentist to prevent. Um, it's a matter of prevention.
mhm.
Um, as I was talking before about the linkage between like gum disease and diabetes and gum disease and heart condition. So they're completely linked. So please care about yourself, try to prevent those problems. Prevention is the best care possible. It's safer, it's less expensive. I tell patients, don't spend your money with me with the bigger treatments. Come here every so often. Let's chit chat. Let's talk. Let me educate you. Let's prevent. So that's my best goal.
Mm. Well, thank you so much, Dr. A. I know you have
My pleasure.
going, and thank you so much showing us what your office is doing to protect the patients and your staff during
Hmm.
this time period. And I mean, you've ordered more equipment to make sure everybody's safe and protected. So this is great. And
Yeah. If you see like the sterilization area, we try to keep it very neat and clean.
mm,
Um, and then you follow, they like have washers so the staff don't have to wash with their hands. The instruments afterward to avoid contamination. You have the N95 mask, you have the gowns, disposable gowns, you have the shields, As I said, I'm doing my best. I'm trying my best to keep everyone safe.
I see, I see. And can you give the audience one more message about the importance of mask? I totally get it. I totally understand. The mask, this is how I see it. The mask and those shields are there to protect others. So even, I've heard people say, oh, they're so uncomfortable. I only wear them if I go to the store, but I see so many people out walking, jogging at the park, and they don't have on their masks. And I said, to me, I'm thinking you have to step outside of yourself. You have to think of others. That's why you wear the mask. What is your message to people as a
So
healthcare expert about masks? Because dentists, doctors, you all you've been wearing shields and masks forever.
mask
So
for
it
very
means
long.
something. It means something.
100%, 100% agree with you. And it was actually sad to see today, once I was driving here to the office, I noticed so many people not wearing the mask. And then it's a warm day today, and then people feel like it's very warm to wear that mask. But as you said, it's not about you anymore. It's about others. We talk about the elderly. We're talking to people with hypertension, with diabetes. They can die. They can die because of the COVID. And how would you feel if you're the culprit of it? So that's what you have to think. We don't want to be the cause of the problem. If you don't want to, like, if you feel, and no, I understand a lot of people that feel like, hey, I feel great, I don't have symptoms, but that's the problem of that disease. It's the unknown. You can't transmit the disease even though you were not you were contaminated. You already can transmit, but you don't have symptoms, and that's what's like the most dangerous thing that's going on. And again, just protect yourself so we can protect the others. So it's just about loving and caring, and then preventing. Love your community. That's what we're here for. In Evanston, it's like, since I know Evanston, I feel like the strong communities like feeling. It's very strong. So let's be a little stronger now, and then we'll get through it. This will not be forever. It's just for a while. As long as we can make people be alive, like, I understand everyone wants to work, everyone wants to do their thing, but let's, it's just for a little bit more. Let's try, let's keep pushing. It's like a competition that our enemy is COVID. Our enemy, we are not each other's enemies. COVID is our enemy.
Mm, thank you. I like the way you put that. We are not the enemy. COVID is the enemy. Wow.
Thank you.
Gosh, I just keep thinking about those women that were on my page. Like, why are you debating with me over this? It's
Exactly, yeah. Let
crazy.
them know AI is not about those numbers. It's about the message, as always.
Right.
It will be always about the message. And again, thank you for what you do for the community. Really, thank you. We do appreciate it.
Thank you for what you do for the community. Thank you.
That's my pleasure. It's always my pleasure.
All right, Dr. A. So we'll be following back up with you, getting some more medical advice. And yeah, yeah,
Whenever
you're
you
my
need it.
dentist now. You can't
Thank you so
my
much.
dentist now.
I'm here for you. Whenever you need it, any question, I'll be here for you and for the community as well.
All right, Dr. A. Have a great day.
Thanks so much. Okay.
All right.
Bye bye.
Okay, this is Malika with Evanston Live TV. That was Dr. A. He has Wade Dental right there on Main. He's right over there by Food for Less, brand new office over there. And as you can see, he has it all set up. He's ordered new equipment. He already has equipment in there, but he's ordered more to make sure that everybody is safe and protected in his office. His patients clearly mean a great deal to him. And it's just amazing how this COVID-19 has just really just changed and how we interact, how we deal, how we do business, how we, deal friends, family. It's changed everything. So Dr. A is one of the offices that you can go to for dental work, and he is taking precautions to make sure that you're safe. Absolutely love that. And you guys, please, please follow the guidelines. Follow the guidelines. You heard Dr. A. Wear your mask. Stay clean. Keep your hands clean. Just be safe, you all. It's about protecting others. And in turn, you're protecting yourself. Okay? You guys have a great day and be safe.